a method that you guys can use. Huh? It's my mother, this man, she's flipping 76 years old. And this is what you're doing to her. A hospital is supposed to look after her. Huh?
In part one of our three-part series on the medical neglect of elderly patients inside our public hospitals, we brought you the story of 76-year-old Martha Mare, who was tied to a hospital bench on the floor of Mamelodi's casualty ward for several hours. While the Gauteng Health MEC's office reached a settlement with the Mare family in a record 9 months, the Health Department's internal investigation into the matter has not been completed.
Now the MEC, which was not even part of their concoction or their decision, had to apologize on their behalf.
The part that we needed to do was to actually deal with the patient, how they feel, and also as a department taking some accountability.
In this episode, we hear of the agony of Gail Phillips' family after the elderly pensioner spent months inside Witbank Hospital after breaking her femur and eventually died from bed sores that turned into gaping septic wounds during her prolonged stay.
The people did not do what they were supposed to do. You take an oath when you become a nurse, when you become a sister, when you become a doctor, you take an oath. And that oath means absolutely nothing.
Stakeholders in the public healthcare sector say the system is facing huge challenges.
The authorities, the employer, is not coming to the party. Not only inspecting the colleges and the institution, whether nurses are training in the right environment, also to inspect the conditions under which the nurses will have to operate.
Elderly patients remain especially vulnerable within our crippling public healthcare sector. This is the story of one such patient who was let down by the system.
She was fit as a fiddle. She just planted all her vegetables in the garden. She was knitting jerseys for the grandchildren in Australia. And she just started on a new project, knitting squares to make a blanket for the needy, and she was fine.
Pensioners Abe and Avril say Avril's sister Gail was a healthy 80-year-old, but Gail's life takes a turn for the worse when she falls while home alone one Friday winter's morning in June last year.
It must have been gone about an hour and a half. She'd gotten up, she'd been sitting there knitting, and she fell in the passage. And fortunately, she just didn't try and move, she just stayed there. And then we looked at the angle of her leg. It looked weird. So we said, hang fire, we can call you an ambulance.
By the time an ambulance arrives, it's been at least 8 hours since the elderly Gail fell. The ambulance drives her to Witbank Hospital and she waits inside the casualty ward for more than 3 hours. Doctors suspect she has broken her legs. They tell her family that she will need to have an operation to put a pin into her leg and she's admitted to a general ward.
After asking probably for the 6th or 7th time, they eventually gave her some pain medication. We took her up to the ward. It was then pointed out to me that there are no sheets, there's no pillowcases, there's no pillows, no blankets. We have to take our own stuff. So I came home to come and fetch it.
2 days later, other patients in the ward urged Gail's family to arrange pain medication for her.
We went to visit her, and when we were there, the other 2 persons in the ward asked me to please speak to them to give her pain medication because she spent the whole night crying. And they couldn't sleep because she was crying all night and complaining about the pain.
And when she called, because they don't have bells, when she called, no one answered.
This would signal only the start of Gail's nightmare inside Witbank Hospital.
The bath that they expected the patients to bath in is absolutely disgusting. On one occasion, they were all congregating in the kitchen, and I went in there and I saw the plates that the people were eating out of, and I tell you, I don't think I would eat out of those plates. It was disgusting, really disgusting. The hospital being without water for 6 days. And this was highlighted when we were asked to bring wet wipes for the patients. Each one had to bring wet wipes because there was no water for 6 days. And I can't imagine how they kept the patients clean. In fact, I don't think they did.
Abe keeps meticulous record of Gail's hospital stay and treatment to update family members scattered across the globe. This would become a shocking written testament of how an ailing healthcare system, equipped with staff who seemingly failed to follow proper protocol, led to Gail's rapid decline.
It was too risky. She looks well, but coughing.
Friday, 28 June. A healthy but elderly Gail falls at home and breaks her femur. She's admitted to Witbank Hospital. Her family is told she could be walking a day after an operation. Sunday, 30 June. Abe writes that patients are left in soiled nappies. Monday, 8 July. Gail's operation is cancelled due to a diarrhea outbreak in her hospital ward. Wednesday, 10 July. There are widespread water cuts at the hospital. A week later, Gail's operation is cancelled a second time. The family is told it's because she's anemic. Friday, 19 July. Gail waits for her operation outside theatre for 4 hours, but it's cancelled a third time, allegedly because of chest problems. Tuesday, 23 July. Gail's operation is cancelled a fourth time, this time reportedly due to pneumonia and heart failure. The family realizes she's been double dosed with epilepsy medicine that could explain her sleepiness. Wednesday, 31 July. Gail's operation is cancelled a fifth time because of no clean theatre linen. Only a week later, Gail's operation is done. Another week on Wednesday, 14 August, the family is told without warning to take Gail home. Gail was admitted to Witbank Hospital on 28 June for a procedure that, according to hospital staff, could have seen her walking and discharged within a week. Instead, she would spend the next 48 agonizing days inside the hospital. 41 of those days, she lay in traction, rendering her immobile. Her operation was delayed 5 times. She's discharged on 15 August, but things will still take a turn for the worst. The family returns home with Gail. She's wheelchair-bound, weak and incoherent. The family is not informed about any bedsore post-hospital care that will be needed.
And as I pushed her over, I saw this plaster over on her back just above her coxlet. And I said to her, "What's this?" She said, "What's what?" I said, "You've got a big plaster on your back." She said, "I don't know." And I opened it. And I just didn't know what to do because the smell that we'd been smelling it, I didn't know whether it was the patients lying in a wet and dirty nappy or what it was. It was Gail. She was going fraught. I took a ruler and measured it. It's 20 centimeters by 12 centimeters. And it was sort of, and it smelled. But I could put my hand in with it, right, because
It's been 6 weeks since Gail fell and broke her femur. It's an injury that, according to doctors at Witbank Hospital, could see a patient up and walking again a day after a pin is inserted during a corrective operation. But a previously healthy Gail's condition went into rapid decline inside Witbank Hospital, where she lay in traction for 41 days. Now bedridden, incoherent and with massive bed sores all over her body, some have turned into gaping wounds. Gail's family knows she needs urgent medical care in what has become an apparent life and death situation.
We got to hospital, wanted to know where the hospital manager was. First of all, he sent her home without letting us know there's anything wrong like this. She can't walk, and they said that after a day after the hospital, of the operation, she'd be able to stand up and she could start shuffling and she could walk. She can't do either, and she's got this great enormous big sore. So what do you want us to do? And I said, we've got to fix the mess up that you've made.
Witbank Hospital management agreed to readmit Gail the same day and do a debridement operation to remove dead or infected flesh from her bedsore wounds.
When we got there, late on that afternoon, Gail hadn't gone to theatre. Why? No, an emergency came in.
She stayed without food until 10 o'clock that night, and then they gave her food.
And then,
Because they kept her starved so
in
that
case.
Yeah, just in case they could take her into theatre.
The operation is done, but by now Gail has gaping wounds and Witbank staff informs the family that she will need follow-up operations for her stage 4 bed sores. They decide to refer her to the nearby but much smaller Impungwe Hospital.
When we got to Impungwe Hospital, they'd made a complete mess up here of the paperwork. They actually had to call out a doctor who was on standby to come and talk to us about Gail and what was going on. And he just said straight out to us that, look, they're not equipped to do this, so you'll have to go back to Witbank Hospital.
Over the next 2 weeks, a very frail Gail is sent back and forth between Impungwe and Witbank hospitals, both seemingly unable to fully treat such severe bed sores. Meanwhile, her condition is worsening. The families put in touch with this woman, local activist Tess Rickert, who has assisted other families in medical malpractice cases in the past.
Witbank Hospital have been battling with water supply. As far as I know, it's a huge problem there. Hygiene in some of the hospitals are good, but most of our hospitals fall by the wayside with hygiene. And most of the bathrooms that the patients also have to use, it adds to the problem with septicemia, septic wounds and that. Can't really use them. It's sad to say, but it's the norm. It's not out of the norm, it's the norm.
The mainstream and social media coverage that follows eventually reaches this woman, Anne-Marie Kukumur, a private wound care specialist.
The Phillips family pleaded on Facebook for somebody to assist them due to the fact that she was in hospital for such a long time. And my company, Genodyne Equity, said that they are prepared to sponsor her treatment. Doesn't matter how long it lasts, as long as we can help this patient.
In an unexpected turn of events, Witbank Hospital management makes the unlikely concession to allow Anne-Marie Kukumur to come and treat Gail's deteriorating bed sores inside the public hospital.
She had very large wounds, necrotic wound on her sacrum and on both heels. It was a stage 4 on all 3 areas. She was nursed on a normal hospital mattress, not according to the assessment tools. Her legs was bruised and the fluid was seeping out, and they've covered it. So at the end of the day, her condition was not stable.
Anne-Marie says if nurses follow the correct protocols, bed sores are easy to prevent, but even once they develop in the early stages, it is easy to treat if the right guidelines are followed.
By improving blood circulation and then excluding your comorbidities. Your comorbidities are the combination of conditions that causes the skin to deteriorate. If the skin continues staying wet, that is a big cause of your superficial wounds and shear and friction. And then to treat it, very easy, as long as you improve the circulation, apply the right type of plaster.
Nothing can seemingly explain why Gail would have developed such severe and life-threatening gaping wounds, except to assume that at least some guidelines were flaunted during her prolonged stay inside Witbank Hospital. On 21 October last year, Gail Phillips died inside Witbank Hospital. It had been almost 4 months since an otherwise healthy Gail fell and broke her femur. Her unsuspecting family never considered this fatal outcome when they took Gail to hospital in June last year.
My dad is last one.
Her beloved dog Rolo, who never left her side, is also left pining over her sudden absence.
A nurse has got a job to do. The sister has got a job to do. Her job is to see that the nurses do their work, as well as she is responsible to do certain amounts of work. The doctor doesn't even realize that the patient has got bedsores. Right from the bottom, it's rotten right to the top, and everybody has got to be held accountable for what they do.
Wound care specialist Anne-Marie Kukamoer says if basic health care is flaunted and the hospital environment poor, bedsores can develop in a patient and be fatal.
Your elderly people are high-risk patients, or you're physically impaired, you're mentally impaired, those type of people that are bedridden, who are not moving as mobile as possible, they are prone to bedsores due to the blood supply that's not good. So yes, you can have bedsores easily, quickly, and it can deteriorate just as quick, but if you do your risk assessment, as every ward, every sister needs to know their risk assessment tools, you can prevent it.
Nursing training has come under the spotlight in recent years. While the prevention of bedsores require the most basic nursing care, many public hospitals don't have enough specialized nurses who can deal with pressure wounds once they develop.
Some of the hospitals have wound care specialists that's supposed to implement the prevention of pressure injuries or bedsores. So we all have the tools. There are 3 major tools. It's the Waterloo, the Norden and the Baden risk assessment tools. The Waterloo protocol is the one that's been used mostly. It gives you questions and you have a score at the end. So at the end you can determine if it's a low risk to high risk, and every nurse being trained know about the risk tools that's available, and an orientation in every ward, in every hospital. It is part and parcel of their orientation.
But despite serious questions that arise around the implementation and the following of protocols in public hospitals, South Africa is believed to have some of the best trained nurses in the world.
We can proud ourselves as a country that we are producing good quality nurses. And having said so, these nurses are very are needed in countries, developed countries, and they are capitalizing on what South Africa is producing. Prior to 2007, the Department of Health came up with a retention strategy called Specific Occupation Dispensation, the OSD. When it was introduced, a lot of nurses came back to the country, and we were also confident that that is a way to address the shortage of nurses, 1, 2, to address the issue of nurses being better remunerated. Sadly to say, it did not yield the expected results. We are still experiencing that nurses are going overseas for greener pastures.
Some stakeholders say overcrowded and under-resourced hospitals in the public sector put patients' health at risk. Special Assignment is in possession of this list of concerns and a letter of demand raised by healthcare workers at Witbank Hospital in June last year. In the document, healthcare workers raise concerns over the lack of the most basic resources. The poor conditions listed are serious, the chronic shortages widespread, and the outlook bleak in a seemingly crumbling hospital system. Special Assignment approached the acting CEO of Witbank Hospital, Dr. Johannes Longwane, for comment without success. While the number of medical negligence cases against the health department increase at an alarming rate, a growing number of healthcare activists say our public healthcare managers and workers have lost their compassion along the way.
It's folded. It's heading to a disaster. I don't think we can recover. That's my personal view, is that we can't recover from this. It's gone so far. It's going to take a miracle to recover from this.
It must go out to the public so they know what's going on, and maybe it's going to make the people actually start doing their job properly.
The people did not do what they were supposed to do, and you take an oath when you become a nurse, when you become a sister, when you become a doctor, you take an oath, and that oath means absolutely nothing. And I think they don't care, they don't give a damn.
In part 3 on our series of the medical negligence of elderly patients, we highlight the growing number of litigation lawsuits against the health department after the deaths of elderly patients inside public hospitals.